Welcome to Mountain Mama's first aid training for this month. We're studying musculoskeletal injuries, which is super fun. Let me get a little closer here. Mostly because this is everything that happens. These are can be very common injuries. We're talking about sprains, strains, dislocations, and fractures. Hopefully all we're going to be dealing with in our future is sprains and strains. They are a pain in the butt. So just to kind of let you know the difference between a sprain and a strain. A strain is something that is overstretched tendon or muscle that attaches a bone to a muscle. A spring is a bone to a bone at a joint. When you're thinking about your ankles, and that's usually what we get sprains and strains on, it all just hurts. And pretty much the treatment for both is the same. We're going to do RICE. So rest, ice, compression, and elevation. So resting, if something happens, we're going to go with, for example, an ankle injury. You torqued your ankle. We've had 2 injuries in the last month. A gal walked off a curb. Another gal was something weird on a stair. So this can happen anywhere. And then you will hear pops or tear or feel severe pain, maybe see bruising right away or swelling. It starts to swell, all these kind of things. You know that something went wrong. We don't know if we've got a sprain, strain, or a fracture. But we want to start and keep people, we want to start with RICE first. So we're going to stop what we're doing and rest. If you can have somebody rest for that first 30 minutes, that's really important to an injury while you're kind of trying to assess it and kind of get things going with it, your treatments and such. So 30 minutes of rest, ice. If you happen to have an ice pack, we carry these in all our first aid kits. They're just you pop them and then it gets cold. You can also use a stream that's really cold nearby, have them put their ankle or injured, whatever, in that cold water as much as they can. If you have actual ice, you just want to be careful you don't put it right on skin. So have a thin cloth between that. You just don't want to get any sort of burns from the ice as well. And then, or if you just only have cloth, a cotton cloth that you can put on your injury and just let the wind kind of evaporate, use evaporation to cool it. So that's your best bets for in the mountain ice. And then compression. If we can use compression to wrap, we want to kind of keep it strong, you want compression to keep it from swelling as much. And that will keep the injury, we'll let it heal a lot better. Now, if you have nothing, then keeping a boot on, if they have a hiking boot on, keeping that on and keeping that tight is probably the best thing that you can do. That boot will provide compression. If you do need to take that boot off, if you want to assess and take a look and see all the things that are going on in there, of course, just be careful because you're going to try and get that on soon. Foot is just going to start swelling and swelling. You may not be able to get that boot on again. So make sure that assessment's pretty quick. If it's, I don't know, I'm going to let that be a judgment call on boots. Because I prefer to take a look at the injury and kind of see what's going on. So I prefer a wrap. And we're going to talk about wrapping here in a second and how to wrap. Then the last step is elevation. We want to make sure that injured limb or joint is above the heart. That will help with circulation and swelling and stuff as well. And then we want to provide people with pain medication, usually an ibuprofen or a Tylenol, of course, asking them on medication injuries at all. Some tips, if you have somebody that gets back pain suddenly, say we're backpacking or hiking or something like that, you can do cold for 20 to 30 minutes and do that several times daily for the first 24 hours or 2 days. Just know with most of these tears and injuries, 2 days is what you want to do for ice. 3 to 4 times a day would be kind of what we recommend. Then after that, then you want to start doing the same thing, but with heat as well. And hopefully by then you're home, especially if it was bad. And then continue just to do heat and the ibuprofen or Tylenol as well. If you have back pain that comes on slowly, this is the catch. If it's been going on for a while, likely it's a chronic injury, you can just go right into heat because we're thinking that's probably not an acute injury that we need to apply cold to decrease swelling and things like that. And then as far as evacuation with these injuries, if you have someone that has back pain that you think is a result of a strain or sprain, the concerns that we are looking for is numbness in the extremities, or if that pain is shooting down kind of through their butt, down their leg, sciatic type pain, pain that will continue to be strong even if the patient is at rest, pain that has come on as a result of an illness. So they already have abdominal pain or they're nauseous and we're still having back pain. That could indicate not necessarily a muscle strain, but maybe like a kidney infection or other things like that. So you want to just kind of be aware of your back pain as well. And then of course, if someone had a fall and all of a sudden a sudden back pain, that's somebody we want to evacuate as well. So that's kind of like basic overview of sprains and strains. I want to go into splinting and taping, which is lots of fun. We're going to start first with taping. Just know if you apply compression at all to any joint, limb, whatever, you want to do what's called CSM. So you want to check the circulation, the sensation, and the motion of that. So say like if I was going to wrap my finger like this and I wrap it too tight, it's going to start turning red and purple and will eventually not have any sensation. So I'm noticing when if you want to make sure that your wrap or splint was too tight, a good rule of thumb is to touch the extremity, the whatever is on the end, and check. And if you push on the end and it goes blanches, which means it goes a lighter color, and then you take your finger off and the blood comes back within 3 seconds, then you're good. If you do that, it goes white and it just stays white for a while, then you put it on too tight. So that's circulation. And then sensation is if it's gotten numb after you put on a splint or taping, that's not good. And then of course, motion, if they were able to move it without much difficulty, pain, and you've put a splint or something on, they shouldn't be able to move the joint you're trying to immobilize, but they might be able to wiggle their toes. And you want to just kind of be aware of stuff like that. So check CSM before and then also after. We check before because if they didn't have circulation before because of the injury, that's good to know that they're not going to have it after. So anyway, we're always going to be making sure we check that. So first off, we're going to do some taping of injuries. Now I am just using the tape from our first aid kits. And so I'm not going to use a ton, but I'm going to just kind of do a framework. I'm going to post the notes for this, the outline for this on our Facebook page. And so you'll be able to see an example of how to tape well. So I have my awesome volunteer who is going to be giving us his ankle. All right, let me have you put your ankle. Let's get a chair here. All right, if you want to just throw an ankle right there. All righty. Excellent. Okay. So we have somebody who has twisted their ankle. They're having some pain, but I'm not seeing too many crazy things going on here, but they're just having some pain and we want to provide them some support. Taping is a really good thing to do. So the very first thing we want to do, this has 4 steps. So first step is we're going to do a ring around the ankle about 6 inches up. All righty. Well, that was the chunky stuff at the top. Okay. Yeah. Okay. So we do a tape at the top. All right. Then our second is going to be, we're going to do a tape midfoot. Yeah.
Sticky.
Our tape's not very sticky.
Demonstration.
Demo tape. Reusable demo
Those are my
tape.
hairy legs.
Step 2. Step 3 is doing stirrups. I'm going to just do 1 for just our lack of tape, but you would do 2 or 3 if you wish. Those are going to go from the foot up to this area. I'm going to tape them up here. Just tucking. This is hilarious. Okay. All right, and then the last is we're gonna do a figure 8 for the rest. So I like to start on the top of the foot. And what a figure 8 is, we're just gonna wrap around. There's a zillion better YouTube videos that could be doing this, but you'll kind of get the idea as a simplified version. So here, this is the top of our loop, our 8, and then we go on the back of the heel and do the other loop of the 8. Does that make sense? All right, and then we're gonna go back here. This is awesome.
It's a big idea.
Oh, there's tape there. It's sticky at the bottom. And we're gonna go, we'll wrap. So one wrap around here, one wrap around the ankle, another wrap around here, and it's gonna, you're gonna slowly work your way until they kind of connect here. Try, if you can cover the heel, that's a great idea. But if not, that's fine. We'll check our circulation and stuff again, making sure that he can still feel his toes and all that sort of stuff. But this actually, those 3 steps, a wrap here, stirrups, and then a figure 8 is a great way to provide some support in the mountains in the backcountry. A tip is to make sure that your medical tape is sticky. That's very helpful. All right, so that's kind of just a basic ankle taping. If any of you ladies are physical therapists, by all means, let us know on any of our trips, because we'd love to know tips on, there's many other ones you can do for wrists and things like that as well. But that's just a simple ankle one. All right, thank you. All right, so that is taping. Now we'll get into splinting. Now, splinting is something that we're going to do whether something's sprained, strained, or of course, fractured. Essentially, what we're trying to discover with an injury is whether it's a usable injury or a non-usable injury, meaning can they walk out with this injury on their own power, or do we need to splint them and possibly carry them out? So it's kind of one of the things that you're trying to figure out. And one of the things that you're going to use as you're splinting somebody is thinking, do I need to make a splint that they can walk out on? Or is this a splint that we need to make sure that we can carry them? We're also going to have to build a litter to lay them in and carry them out. So it kind of depends on your injury and how severe things are going on with that person. Okay, so let's say we've got, or let's see. Let's talk about, let's see. Let's go to, actually, before we go into splinting, let me talk a little bit about fractures and dislocations, and then we're gonna have lots of fun with our volunteer. We have lots of cool things to use for splints. So dislocation, of course, is something that you're gonna look at an injury and it's not like the bone is not in the right position. Those are pretty easy to discover. I've had a dislocated finger. It was very obvious that it was dislocated. Usually if it's around it, it's gonna be around a joint. That's where they happen. So most dislocations, especially if it's a shoulder dislocation, that's one of the most common. The person probably has had this happen many times before, and they can probably walk you through how to relocate that shoulder. The shoulder dislocations are they have many steps, and we're not going to go through that today, but you can go online and check that out and how to relocate a shoulder. But usually I'm going to just say if they have a dislocated shoulder, they're usually going to be able to tell you how to do it. Other common dislocations, we've got, you can have fingers dislocate, ankles dislocate, knees dislocate, any joint can dislocate. Pelvises, we're not going to relocate. Yeah, there was a few, obviously cervical dislocations we're not going to relocate, but most of the other ones you could if you were far, far away from medical help. And I think that's the big caveat. If someone has a dislocation and you can get them to medical help within a couple hours, then do that, because damage can happen when you're trying to realign a joint. But if you're out we're like 3 days out from help or something like that, it's good to know just the tips of how to do a relocation on a joint. So essentially what you're going to do is provide, can I borrow your hand? Let's say we have a wrist, let's say we have a thumb dislocation. We'll keep it simple. And it's all torqued. So you're going to provide gentle traction, which means you're going to pull. And a lot of times, depending on what bone or what joint is affected, you might have to have someone else holding the other person. And you're going to be pulling gently, and it's gonna hurt, it should hurt a bit, but you shouldn't have, as you're pulling, you shouldn't have severe pain come all of a sudden. If that happens, you just need to stop. But gentle, pulling, and eventually it will slide back into place. So try not to be too intimidated, but just do know that you need to have a medical director supervising your relocation of injury. So it's not something we are probably going to do through Mountain Mamas, but if you ever wanted to know on yourself when you're out in the woods or whatever, that's usually what you're going to do. Apply traction in the line, in line with the bone, and should slide back in there. Fractures are concerning. You've got two kinds of fractures. You've got a compound fracture and just a regular fracture. Compound, so obviously when you got a bone sticking out, that makes things way more complicated. But if you just had a regular fracture, we're just going to go with a regular fracture. Say like someone torques their ankle and we don't know if it's actually broken in there or if it's just sprained or strained. You want to do something called LAF, which is LAF. You want to look at that actual joint. Maybe I'll have my helper put his ankle up here. Great. So say like he just torqued his ankle. So what we're going to do is first look, and I'm looking for swelling, bruising, dislocation, deformity, anything like that. And then the second thing I want to do is ask him, like, how did this happen? Do you feel like it's broken? It's funny, like they say that if a lot of times when people feel it's broken, they're probably right. And then how bad does that hurt? Are we having a lot of severe pain? And then F is to feel. I'm actually going to get in here and I'm going to feeling for warmth. I'm going to gently touch the area. I can feel if there's a muscle spasming. That's an indication that there might be a fracture. And then also if something is unstable or point tenderness, if I'm touching in here, going around, all of a sudden like this hurts exactly like right in this area. When we're kind of looking at the ankle and kind of feeling it, I'm just kind of moving it. I'll move it side to side, back and forth, around, and he's telling me like, oh, it hurts there, or it hurts here, or it hurts specifically here. So if we have point tenderness, that's an indication that you might have a fracture as well. And then I'm also checking for CSM. So we're also looking for blood flow. I'm checking that comes back in 3 seconds, that he has sensation, he can feel, he doesn't have any numbness, tingling here. And that he can move his toes. Can you move your toes for me? Yes. Yeah. And maybe move your foot up and down, side to side, see what he can do on his own. And then he'll be able to tell me what is hurting. And that gives you kind of an idea of the seriousness of this injury. Our treatment, of course, for fracture, we're going to do what we do. We're going to rest. We're going to do our rice. Absolutely. And then if we suspect there's a fracture, we really don't want them to be using this injury or this area at all if they can help it. So if you've got an injury here, that's not as bad as if you have one on the lower half of your body when you have to hike out. So if you've got upper body, then we're going to immobilize that. We got lower body, we're going to do the same thing. Now, immobilization, you want to make sure that you're immobilizing. If you have a joint that you suspect is fractured, we're going to immobilize the bone above and below. If we have like a knee that's possibly, or something around the knee that's fractured, we're going to immobilize the long bone above and below. If we have a long bone, like an arm that we think is fractured, we want to immobilize the joint above and below. So it's either, if it's a joint, the long bone above and below. If it's a long bone, the joint above and below. So that's kind of the rules of thumb as we're going through all these splinting things I'll be showing you. All right. So splinting is lovely when you're in the urban setting and you have so many things to use. Usually in the mountains, you've got whatever's in your pack, whatever's around you in nature, and you're just going to do your darndest. And then you're going to try and evacuate them as best you can. So you're just going to have to get nice and creative. So there's several steps to a splint. First is that you want to have padding. Putting sticks against somebody's leg is going to be very painful, or, anything like right on their skin. So we're going to want to provide some sort of padding to protect their skin. The next thing is we do want something rigid. So something that's going to provide support to the injury. And then we want to make sure that things are long enough to immobilize the areas that we need to immobilize. And then we have something to secure the whole shenanigan together. All right. So we've got some different things we're going to show you today. So, but what we use is not limited to your creativity. So, all right. In the outline, there'll be a whole slew of different things, different splints and things that you can use. We're just going to go through a few today, just probably those, some of the more common ones. I'm just kind of as a refresher for you guys. All right. So first, let's go through. I just want to talk about spine injuries. If you suspect a fractured spine, we want to just keep that person straight on their back and provide a little padding in their lower back. It's called avoiding the void. Avoiding the void. If you have any time you put someone in a split and there's a gap, you want to put some padding in that. So if you had a spinal, any sort of spinal injury, you obviously want to keep them flat anyway in the C-spine precaution, but we'll put a little padding on their lower back to help with that. All right, with legs, we want to keep them mostly straight and with the knee slightly bent and a little bit of padding under the knee. With feet, we want to keep them at a 90-degree angle. Arms, we want to keep them flexed across the chest. Our hands, we actually want them in a little curve that keeps them nice and cozy and fingers in a flexed position. A jaw, we'd actually do a wrap around here, not around here, obviously, something that they could take off quickly. So, but if there's a fractured jaw, it's just as simple as tying a piece of fabric like this up and over the head, like Marley, whatever his name was. Excellent. All right. If you've got a clavicle fracture, we're going to do something called a sling and a swath, and we'll show you that in a second. Where you have, we'll provide a little sling and then we wrap it around here. For lower arms, we'll show you that as well. That's one of the samples where you want to have your hand in a little ball. We're going to have this rigid and then wrap the whole thing and then have that in a sling around your neck and a swath as well. For upper arm, like a humerus fracture, that would be something as simple as a sling and a swath. And a lot of times you have the elbow open because that weight helps pull on that humerus fracture. It's actually a lot more comfortable. If you have someone that has rib fractures, on the side they feel like they fractured something, you can actually put that arm in a sling and a swath as well. And that will provide some comfort as well. You just want to make sure you keep track of their respiration, their breathing, make sure they're doing okay with fractured ribs. That can be a little scary. Pelvis, a fractured pelvis, you would actually just take thick 4 to 5 inch material. You could just cut from any of your spare clothing you've got in your pack, and you're going to wrap that around the pelvis below the little hip bones up here, and above, of course, the pubic bone, and just kind of provide that little security. And then you're going to have them laying down flat on a litter for sure. If you have a hip fracture, so a hip fracture or dislocation is actually where the femur joint comes into the pelvis. So right here, something here is not good. You'd want to gently, on the affected leg, straighten it out gently, and then you're going to wrap both legs together and then also have them on a litter so they're not moving anywhere. And then complicated and compound fractures and stuff, we're not going to really get into that too much. Leg fracture, lower legs, like from the knee down. We're going to do that for you guys today. Those are pretty easy to wrap and just walk on those if they had to. A femur fracture is only, the best one is actually a traction. We want to apply inline traction. That's more than we're going to talk about today as well. If you want to learn that, you can do YouTube videos. I would say just the basic thing is if you suspect and see a femur fracture, you and probably another person, you're going to be wanting to apply gentle traction and strong traction. It's called manual traction, where you are pulling that leg straight in the other direction to kind of like realign that femur bone. Because there are so many, there's blood, we have arteries and nerves and all this sort of stuff that's getting in there and severing. So you want to provide traction and kind of put that realign. But once you've committed to that inline traction, you cannot let go. So you have to be committed to that, but it will provide that person a lot of comfort. And then you would have the rest of your crew being able to do their own. There's like a mechanical one you can rig up that's really cool. But that's what you would put them in. But we're not going to talk about that today. All right, so what we're going to get started with is the lower arm. Let's say we have a lower arm fracture right here. I'm going to have my awesome spouse volunteer provide his arm. Okay, and I might need you actually to sit. I might have to show your face here.
What?
Just sit right here. Great. So I can see you because we're gonna have to do the sling and the swasso, and then all right. Okay, so first thing I want to do is we have these called SAM splints, and they're available in the lead guide. Usually we'll have one of these in our first aid kits. And these are awesome. You can bend them. They're already padded. They have aluminum, so they'll move to the way you want. So I'm already leaving this kind of curled up how it is. And so he can have his hand in there in the position that you want a hand to be in. And this is already, I bend it. Let me show you kind of down the middle. That provides a lot more strength in our splint. All right. So I'm going to put his hand in there. All righty. Provide a little bit of cushioning in there like this. You want to bend it like that. All right. So that provides, has the padding element of our splint and then also the rigidness that our splint would need. And then I want to secure this. Our first aid kits have rolled gauze. You can do this with an ace wrap or whatever. And let's just find our end here. Okay. So what we're going to do, and when you ever do any sort of wrapping, you want to wrap from the far end to the closer end to the heart. That makes sense. So I'm going to wrap from the fingers up. All right. So, all right. We're going to have is that uncomfortable to have your wrist like that?
No, it's
okay. If not, we could put some padding and stuff in there as well. So, all righty. So we're just providing, from the far end. You could even wrap this hand a lot nicer. All right. He wouldn't be holding it up like this because it would be in so much pain. All right. But anyway, so that's how we're securing it. All righty. Great. So that's how we're attaching our splint to our individual patient here. And then you can tape it, tuck it. If you're going through the mountains for a while, you might want to tape that on pretty good. And then we're going to do a sling and a swath, which is a really common splint. Our first aid kits also have triangle band-aids, something I recommend that you have in your first aid kits as well. A couple of cute little pins. All righty. You can make these yourself too as well, and that is just fine. Using 2 triangle bandages works really well for doing a sling and a swath. All righty. There we go. And I like to tie a little knot here in the tip, in the point, the middle point of our triangle, like that, the shorter middle part. Provides a great little place to tuck in that elbow. And then we're going to wrap this. Perfect. Great, great, great. Around up here behind his neck. And I recommend having some padding. You would put something right here behind him, like a t-shirt or something else, because that's going to hurt on your neck after a while. And you want to pull it to its a point. Maybe we'll go a little higher where that's feeling nice. And so your arm is almost in a little less than a 90-degree angle. All righty. Great. And you can pull this down even a little bit further. Make sure we got that. Feel secure. How's it feeling?
good.
Yeah? You're not just lying? Yeah.
I mean, it's on my neck. That's tough.
That's the hard part.
We just adjust that.
Yeah, we put some padding there, adjust that. All right, so this is the sling portion. Now there's something called a swath. And you can take a knife and cut some of your whatever spare clothing you have. If you have a triangle bandage, you can just roll it up into one long, just kind of wrap it up like this. What you would do is you use that. I would probably have one more, but, and you're going to use this. You want to flatten it out a little bit so it doesn't get whenever it's too narrow, it'll pinch and hurt. But anyway, you tie that around there, and this just kind of holds this close to his chest. So when he's walking and running around, trying to get out of the mountains and stuff, that keeps that nice and stable. So this works really good for forearm fractures. And then also if you had a clavicle fracture or humerus fracture as well, this sling and swap works great. Awesome, thank you. All right, we're gonna do a lower leg splint. These are awesome to practice on your family members. Alrighty, so I'll let you. So do you want to go ahead and untie that while he's like, I can't do this by myself. Okay. Alrighty. That's a nice area. So what I recommend a lot for lower leg splinting would be if you had camping pads with you, if you happen to be doing it overnight. These pads work fantastic as splints on the lower leg. Or other places, you can get nice and creative. The SAM splint you can also use as well in a pinch, especially if it's just an ankle injury. I'll show you that quick. You would have an ankle down like this, and we can come down, bring it in like this. I want to make sure that's at a 90 degree, and then you can wrap that up, whatever, like that. And this looks pretty good. So that's an easy one. If you don't happen to have that, not everyone has SAM splints. Then what we can do is use a pad like this. Alrighty. And I'm gonna fold this pad in half like this. Let me have you scoot back a little bit. Okay. What I'm gonna do, let's go like this behind your ankle, and then up the sides. Just relax your leg for a sec, and then I'm gonna grab, if you had medical tape or whatever you need, use that as your securing, and I'm gonna use, I've got 2 hiking or ski poles. These are a little long for him. If I had hiking poles, I could make them a little bit shorter. So they would only go maybe to here. That might be more comfortable for him. But I'm gonna use these 2 on the outside as my stability. So they're right out here. All right. And then I'm just gonna go ahead and, yeah, if you wanna hold that there. There you go. Cool. And I'm going through, and I'm gonna tie these nice and tight. Watching out for the knee. We don't wanna tie anything directly on the knee. Doing the same thing. These other spots here. Nice and tight. Okay. And then behind the knee, back here. Well, okay. And then you can tie this more places here. How is that feeling?
Yeah, it's pretty good.
Yeah, and you can tie it a lot tighter, more straps, you know, things like that. This is a really easy one for if you had to immobilize an ankle or your tibia and your fibula, your lower bones and stuff down here. And you can get this a lot tighter. provide a lot more stability and such. So those are just two basic ones for splinting that we're going to focus on today. Do you have any questions? I'm going to leave this open for a question. If not, give me a nice thumbs up. Awesome. All right. Let's make sure we got all the stuff you guys need to know. I think so. All right. Just as always, the first aid tips and stuff that we're getting, we share with you from our first aid book that is in all our first aid kits. It's the Backcountry First Aid and Extended Care by Buck Tilton. Totally get this in your own first aid kits. Highly recommended. It's got a lot more stuff than we can talk about today. And then we'll have our notes and stuff that you can download and have that as well. So have a wonderful night and we'll see you later.